There's question whether pets may be capable of spreading monkeypox, according to a newly discovered case. And U.S. health officials are now warning your end of summer celebration could be the epicenter for the next monkeypox outbreak. Joining us live to talk about the latest on the spread of the virus is Dr. Brad Perkins, Chief Medical Officer at Carius. Dr. Perkins, welcome to the National Desk. Let's start with this new report out of France. A dog contracted monkeypox after sleeping in bed with its infected owners, becoming the first known case of human-to-dog transmission. My mind immediately goes to places like doggy daycares, dog walkers, dog sitters. Is this something that pet owners now need to be thinking about? And what's the risk of an infected pet passing the virus on to other people?
Yes, well, it's an important new observation, but not a surprise. We know that this virus moves from animals to people and can be transmitted from person to person. You know, we keep learning relearning this painful lesson that infectious diseases occurring anywhere are a threat everywhere. And we're now experiencing this with this multi-country epidemic of monkeypox.
12,000 cases here in the U.S. right now, and a survey by the Annenberg Public Policy Center says that about a quarter of women say that they are concerned about getting monkeypox, even though most of the cases in America right now are in gay men. What is the risk of the general population overall, and who should be worried? Are there more specific groups that should be more concerned than others?
I think everyone in the United States should be concerned on at least three levels. One, certainly if you're a member of communities that are at highest risk, men having sex with men, there's a direct risk to your health. But certainly we're starting to see the edges of that sort of concentrated transmission move. You talked about dogs. There's been a couple of cases outside of men who have sex with men. You should also be aware that you have a responsibility, if you develop this disease, to protect others. But everyone should be concerned about this disease becoming endemic in the United States. We have a small window of opportunity to stop transmission in the United States, and we need to take every effort and make every investment to not allow this to become a permanently established endemic disease in the United States.
Yeah, you mentioned protection in this. Realistically, what can people do to protect themselves? And if you get it, what is the worst case scenario?
First of all, you should be aware, particularly if you're in communities of men who have sex with men, you should be aware of the health of others that you're interacting with. You should certainly, if you become infected, you should follow the CDC's recommendations for isolation so you don't expose others. And I think every American should be watching the news carefully about cases that begin to occur outside of this concentrated risk population currently. We would like to see continued government investment in research to improve a number of aspects of our ability to control this infection. Particularly, we work on diagnostics. We think there's an opportunity to improve and move the diagnosis of this disease earlier in its cycle. That will allow people to get treated earlier, and it will allow public health to do their work to contain infections around those individuals. There's opportunities to further test antiviral treatments that have been developed and approved actually for use in smallpox. There's also a lot of opportunity to learn and improve vaccines that are available for monkeypox.
Just about 45 seconds left here that I have with you, Dr. Perkins. I'm curious, summer winding down, Labor Day is coming up, the last big hurrah for a lot of people with things like musical festivals, other crowded events. Is there something to be learned from, say, COVID? Should we be social distancing at large gatherings, whether that's with families or strangers, to avoid monkeypox?
I think not at this point, but keep an eye on public health recommendations, both local and federal. I think awareness of your surroundings and your activities, exposure to people that have known monkeypox, those are precautions that should be taken. I think encouraging communities that are at risk to see physicians if they think that they're sick, and following appropriate guidelines for isolation if they think they have or have been diagnosed as having monkeypox.
All right, something to keep an eye on. Dr. Brad Perkins, Chief Medical Officer with Carious, thank you so much for joining us this morning on the National Desk.
Thank you.